So we're here at the Last Dollar Studio at the University of Creativity, and I have my friend Dr. Randy Wykoff, who's the head of the School of Public Health, Eastern Tennessee State University. Did I get that part right?
That's right.
Yeah.
East Tennessee State.
Yeah. So tell me, Dr. Wykoff, what exactly does that mean?
Well, public health is what societies do to create conditions for people to be healthy. So food, water, shelter, safety, sanitation, changing behavior, but even into things like education, economic development. What do we have to do as a people so that all of us can be healthier? That's public health, and we're trying to train the next generation of folks to do that.
So it means we need to have more parties, is what you're saying then. There needs to be
relaxation and happiness are definitely part of being healthy.
Yeah, and we can celebrate having food and water.
That's right.
So you're teaching the basics then. Yeah. So there's a school here where kids are coming to get degrees in learning the basics.
I always think any field you're going to learn, it's just like you learn to play guitar, you don't start by fancy stuff. You start by learning the basic chords. And the same with any academic field. You got to start with the basics. If you can't provide the basics, food, water, shelter, safety, sanitation, first aid, and infrastructure, it's really hard to get out there and say, here's an elaborate project to reduce poverty in rural Appalachia.
Yeah.
Everything builds on the basics.
Yeah. So reduce poverty in rural Appalachia. That sounds like a little bit of a tough topic right there.
Yeah.
Yeah. So you were mentioning something to me earlier at lunch about there's still a great poverty that exists even here in the state of Tennessee.
Yeah. Yeah. No, we have counties where 40% or more of the kids live in poverty.
Yeah. What's considered poverty here?
For a family of four, it's about $24,000 a year.
$24,000 a year.
From all sources, including entitlement programs, everything else. Total income.
Total income. Whatever somebody gets any kind of money from. If they have under $24,000 a year to work with, that's considered poverty. And in that situation, what's poverty typically mean for them? I mean, what is that? What kind of conditions does that bring on for somebody?
Well, it depends where you are. The more rural an area, the less resources are there for people. They may not have running water. They may not have in-home sanitation. They may.
You mean they may not have a bathroom in their house?
They may not have a bathroom. They have trouble getting. I mean, we have some counties where people have to drive a half hour or more just to get to a minimum wage job. So if the less resources in a community, then they're not going to have health care. They're not going to have an educational opportunity. It's one of these things that just snowballs.
Yeah. So that's probably one of the reasons that urbanization continues to take root, right? Isn't there a condition happening in the country, most places around the world actually now, where people are moving towards more rural, more urban areas from rural areas?
Very, very common in the developing world where there are no jobs out in the rural areas.
Yeah.
People move to the cities even if they don't have jobs. Oftentimes being in a city is a good thing because there's opportunities there. There are jobs. There is sanitation. But a lot of times we're starting to see now in some of these mega cities with 20 million people, there aren't enough jobs. There isn't sanitation. And once you get a disease of some sort in there, it can spread widely.
Yeah. Unless you see people coming into urban areas, you see huge areas of poverty right next to greatly developed cities.
We've looked at poverty in Tennessee, for example. We have one county in Tennessee that's one of the richest counties in America. It's in the top, I think, 25 counties. Then we have 15 counties that are in the bottom 10% of all the counties in America. We have 3 that are in the bottom 2%. So we have wealth and poverty in the same place. If you live near that wealth, even if you're relatively poor, you can probably get access to health care. You can probably get a job. If you live in some of those rural, poor areas, health care is tough. It's not there. You don't have the money for it. It's a real challenge.
Yeah. So what are we going to do?
Well, you've said it yourself. That is, it starts by caring for each other. We got to understand that all of us benefit when all of us pitch in.
That's it.
You talked about your parents and how communities would work together to support, to raise a barn or whatever it is. We've sort of lost a little bit of that. And I think we have to get back to understanding that if we help each other, we all benefit.
Yeah. Amen to that. We're all in this together. Yeah. What keeps you up at night?
A couple of things. I worry that we've made it easy to isolate and alienate poor people. We've made it easy for ourselves to say, it's their problem. It's their problem in terms of being another country. It's their problem in terms of being poor. This idea that somehow we don't care about each other keeps me up at night. And then from a public health standpoint, I always worry about, the number of people that are here now. And so, the world's population has quadrupled 4 times since my grandfather was born, tripled in my dad's lifetime, and doubled in our lifetime. That's a lot of people. With this, we haven't doubled the amount of food that we can grow. So, the potential for disease spread, a lack of opportunity, famine, lack of clean water, those things are on the horizon if we don't do something about them.
So I would expect that, if we'd had a conversation like this 10 years ago, it would have probably had a similar text to it as what you just said. If we did it 20 years ago, if we did it if 50 years ago when I was born, there's probably always been this concern. And because of that concern, we've actually we've drastically reduced poverty and the numbers in this country and globally. And my understanding, almost cut in half since the mid-'90s. So what you're saying is this: the concern is that we at least always have to keep an eye towards the future, because there's so many things that we're up against that could be catastrophic if we don't stay at least one step ahead of them.
Yeah, and you're right. And I think we sometimes tend to forget the successes that we've had. Right?
Yeah.
Under 5 mortality, which is sort of a basic measure of health, has almost been cut in half. I mean, we're doing some really good things, but as you say, if we don't keep it up, we risk losing everything that we've gained.
Yeah. Well, we don't want to lose it. We want to keep it going forward, so we have something to celebrate, to motivate us to do a little more.
Right. And there are resources, right? Maybe the greatest resource we have today that we didn't have 50 years ago is knowledge.
Mm-hmm.
We know a lot about about diseases. We know a lot about the things that make people healthy or less healthy. Mm-hmm. And we just have to take that knowledge and apply it the same way we did 50 years ago with immunizations. We have to do the same thing today.
Yeah. Immunizations, vaccinations.
Yeah.
We vaccinate. I mean, we're constantly, it seems like about once a year, a decade ago it was SARS, and now it's coronavirus, right?
Yeah.
So, what is if everything worked out in the absolute best scenario, how quickly can you even build a defense? You even have to know what the bug is you're trying to build a defense to before you can even build it. And without having the tools in place, like we have a CDC here in America, right? Then you're way behind in even having that opportunity. How fast can you even build a
defense?
That's
a good question.
And
there's sort of 2 answers to that. One of the things we've done well is we've set up early warning systems. So now we know about this coronavirus in China, where maybe 20 years ago we wouldn't have known about it yet.
Yeah.
So that's a good thing. Early warning, seeing the early signs of an outbreak. The second answer is we need to develop drugs, antiviral drugs, particularly that work against multiple viruses. Maybe a third track is vaccines, but it takes a while. Once you discover a virus, it takes a while to develop a vaccine. So I think the best quick answers are, let's see it when it's happening, and let's have some drugs that we can use that work against many viruses.
Yeah, I think that's the whole plague sort of a concept is one of the things that I think most accurately, succinctly illustrates how we're all in this together.
That's right.
As long as the world is connected, as long as we're flying from one place to the other, we think about the catastrophic things from warring factors and radical factors all around the country. We first kind of bring them to mind, but then not thinking necessarily that one of the biggest bombs in the world can be dropped just by someone traveling from one place to the other and coughing, right?
So we've come to realize that we're not more than one plane ride away from someone with Ebola appearing in the United States.
Yes.
But the other side of that coin is we're not more than one plane ride away from taking a life-saving medicine to a kid in sub-Saharan Africa.
That's it.
So that coin, we just have to spend it the right way.
Yeah. So if we can stop it in its tracks in one place, then that is probably the best way to spend the coin, so it never makes it to the other place. And wherever you're learning what it is, then you're learning the information you need to build the defenses to it.
And at the end of the day, we all have to work together on this. This isn't something that one person or one country or one state can do alone.
Yeah.
We've all got to do it together.
We have to.
Yeah.
Yeah. Well, by golly, that's some interesting stuff there, Dr. Wykoff.
One might even say we need to love everybody.
Yeah, I definitely for that one. So when you're not thinking about things like this, what else do you like to do?
I play a mandolin. I play in a band with a couple of guys I've known since the 80s.
There you go.
And,
There, once again, music. Yeah, music's what does it, right? Yeah.
Yeah, it's important to have something where you can relax and unwind, and friends are important.
Yeah.
I do martial arts. I've done that for 25 years or so.
So if we need somebody to kick somebody's ass, you can take care of it.
I know who to call.
There you go. There you go. There you go.
And of course, I have 5 kids, and
yeah.
my family is extremely important to me.
Yeah. That's definitely a blessing that you and I both get to share. Man, it's just awesome to have that around you. Family means so much. I was reading this thing not long ago talking about that, how, when people are in groups of less than 100 or 200, I think it is, where they all relate to each other. They all the differences seem to dissipate, and they all can see the concern for each other and compassion, empathy, and those sort of things for each other. But once you start going outside of those numbers a little bit, then that effect just gradually starts to move away.
And you see, you think about how humans evolved. We started as hunter-gatherers.
Yeah.
If we're hunter-gatherers, we need to rely on each other.
Yeah.
If you go out and get a squirrel, I want some of the meat, and if I get out and get some ground nuts, you get some.
You like squirrel?
Well, I'm a vegetarian. But then we moved into agriculture, right? Then still we needed each other, but not as intensely.
Yeah.
We got into the industrial age. Oddly, even though we got these mega cities, we needed each other less. And I think it's yet to be answered. What is the information age? If we can actually interact without ever seeing each other, what does that do for how we need each other? I think in a way it's going to tell us that we need each other more than ever.
Yeah.
We really need to understand that at the other end of my cell phone or my text is a human being that I need to care about just as much as I did when we were hunter-gatherers.
And it's just different. You can talk to someone over the phone or have a conversation with that person right in front of you, and it's a total different experience.
Well, look how we communicate. Okay, if I send you an email, maybe 50 words, 60 words, you send something back.
It was 1 word, 2 words. Yes.
I send you a text, but when we get a chance to talk,
Yeah.
our ideas flourish.
Yeah.
And suddenly I'm like, we're talking about a conference that you've been at or some folks you've been talking to. I talk about something I care about. And it's a completely different level of interaction.
Yeah.
It's much more human, if you will.
Yeah. Put a little music in with that, and it really becomes human.
Yeah.
That's what you're saying right there, and what we're speaking of here is the exact reason why live music, the performance of music in our industry has continued to grow as the recorded music side of it has maybe not flourished as much. People like to listen to music. Everybody loves people are consuming more music on a daily basis, which has been good in the digital world. But fortunately, there's still something that they miss from that they get in a whole different level when we're together and everybody's, pumping your fist in the air and singing along together.
I hadn't thought about it, but you're right. It's an interesting observation that there's absolutely no reason from a hearing standpoint that I would need to go to a concert or hear live music. I can hear it on my phone. and yet we still go.
Yeah.
And I think humans crave human interaction.
Yeah.
And increasingly there's a whole, sorry to make this too scientific, but there's a whole another body of knowledge about the impact of loneliness on the elderly. And loneliness is becoming a major public health issue, realizing that folks who can't get out as much as they used to, don't have those social interactions, really suffer, both in terms of emotion, but also in terms of physical health.
Yeah. Yeah. I mean, just having physical interaction just keeps someone's just mind going in a positive way, and their age also. So, do you think we can end hunger?
Oh, yeah, absolutely.
Do you think we can end poverty?
Yeah. I think, it's like every problem, there's major steps that can be taken relatively easily. That last 20 miles, that last 20% is always more difficult. But we can move in a great direction in eliminating hunger. We can do it with poverty. But we've got to sort of sometimes rethink the very models we have.
Mm-hmm.
But again, it starts with a belief that this is something we want to deal with and something we have to deal with.
Yeah.
And I think at some point we'll need to see some control in the growth of the population, because we can't keep ending hunger if we keep getting more and more people. But I'm optimistic.
Yeah. Well,
Except when I'm up at night, and then I'm not so optimistic.
Yeah. Except for thinking about what keeps you up at night. Yeah. So, my last question to you, since you do what you do, which is, run a big part of a big school here in our state of Tennessee, and also in our country, is tell me why someone who's looking at deciding what's going to be their career choice or their career path, and they have the opportunity to look at schools or go to schools, why do you think someone should make the decision to become a student of the School of Public Health at Eastern Tennessee State University?
Well, I think, any accredited school is going to give someone a good education. We're committed to doing something beyond that. We really want to focus on the hands-on, practical skills. I want to make sure that my students can work in a low-resource setting after a disaster in a developing country or in rural America. It's one thing to know the importance of water, but if you can't make a water filter, if you don't know how to get clean water to folks, people are going to die in a disaster. So I always want to make sure folks know food, water, shelter, safety, sanitation, first aid, and infrastructure. And that's my commitment. The other thing is, we're better to study public health than in Central Appalachia, where our challenges are so great. We got real opportunities, and I want my students to be able to address those opportunities in a real way.
That's awesome. Dr. Wykoff, thank you so much for being here at the Last Dollar Studio at the University of Creativity, and we're going to give you some peace, love, and happy hour peanuts on your way out.
Oh, that's great. I love it. Thank you very much.
That's fantastic. There you go, brothers and sisters. Conversation with the professor here. This is a smart man. Check him out, Eastern Tennessee State University.